Which of the following conditions is characterized by high blood pressure consistently exceeding 140/90 millimeters of mercury? A. Asthma. B. Heart failure. C. Hypertension. D. Chronic obstructive airways disease. The correct answer is C. Hypertension is defined as high blood pressure that consistently exceeds 140/90 millimeters of mercury. What is the main cause of ischemic heart disease? A. Bacterial infection. B. Viral infection. C. Atherosclerosis. D. Genetic mutation. The correct answer is C. Atherosclerosis, a buildup of plaque in the arteries, is the main cause of ischemic heart disease. Which of the following is not a symptom of heart failure? A. Shortness of breath. B. Persistent cough. C. Swelling in the legs. D. Chest pain. The correct answer is D. Chest pain is not a common symptom of heart failure, though it may occur in some cases. Which medication is commonly used to treat hypertension? A. Insulin. B. Antibiotics. C. Diuretics. D. Antidepressants. The correct answer is C. Diuretics are commonly used to treat hypertension by reducing the volume of circulating blood. What is the primary cause of chronic obstructive airways disease, or COPD? A. Allergy. B. Smoke exposure. C. Genetic predisposition. D. Lack of exercise. The correct answer is B. Smoke exposure, particularly from tobacco, is the primary cause of COPD. Which of the following is a common symptom of angina? A. Loss of taste. B. Ringing in the ears. C. Chest pain or discomfort. D. Blurred vision. The correct answer is C. Chest pain or discomfort is a common symptom of angina, often described as pressure, squeezing, or fullness in the chest. Which type of asthma is triggered by exercise or physical activity? A. Allergic asthma. B. Seasonal asthma. C. Occupational asthma. D. Exercise-induced asthma. The correct answer is D. Exercise-induced asthma is triggered by physical activity or exercise. What is the term used to describe the death of heart muscle tissue due to a lack of blood supply? A. Heart collapse. B. Heart failure. C. Cardiac arrest. D. Myocardial infarction. The correct answer is D. Myocardial infarction, commonly known as a heart attack, refers to the death of heart muscle tissue due to a lack of blood supply. Which of the following is not a risk factor for atherosclerosis? A. High cholesterol levels. B. Smoking. C. Regular exercise. D. Obesity. The correct answer is C. Regular exercise is not a risk factor for atherosclerosis. In fact, it can help reduce the risk. What is a common long-term complication of uncontrolled hypertension? A. Migraine headaches. B. Heart attack. C. Osteoporosis. D. Gout. The correct answer is B. Less than break time equals 1s greater than. A common long-term complication of uncontrolled hypertension is an increased risk of heart attack or other cardiovascular diseases. Which of the following is true about hypertension? A. It is characterized by low blood pressure levels. B. It is also known as high blood pressure. C. It mainly affects the lungs. D. It is not a risk factor for heart disease. The correct answer is B. Hypertension, also known as high blood pressure, is a common risk factor for heart disease and other health conditions. Which of the following medications is commonly used to manage asthma symptoms? A. Antibiotics. B. Bronchodilators. C. Insulin. D. Aspirin. The correct answer is B. Bronchodilators are commonly used to help manage asthma symptoms by dilating the airways and improving breathing. What is a common symptom of heart failure? A. High blood pressure. B. Chest pain. C. Shortness of breath. D. Nausea. The correct answer is C. Shortness of breath is a common symptom of heart failure, often accompanied by fatigue, swelling, and difficulty exercising. In ischemic heart disease, what causes angina pectoris? A. Decreased blood flow to the heart muscle. B. High blood pressure. C. Excessive cholesterol intake. D. Lack of physical exercise. The correct answer is A. Angina pectoris, in ischemic heart disease, is caused by reduced blood flow to the heart muscle due to narrowed or blocked coronary arteries. Which of the following is a characteristic of COPD? A. Reversible airflow obstruction. B. Mostly affects the heart. C. Commonly caused by allergies. D. Progressive lung damage. The correct answer is D. COPD is characterized by progressive lung damage, leading to airflow obstruction that is not fully reversible. A myocardial infarction occurs when A. There is insufficient blood flow to the heart muscle. B. The heart muscle contracts abnormally. C. Blood pressure drops suddenly. D. There is too much oxygen in the blood. The correct answer is A. Myocardial infarction, or a heart attack, occurs when there's insufficient blood flow to part of the heart muscle, leading to tissue damage and potentially death of the affected area. What is the term used to describe the narrowing of the airways in COPD patients? A. Atherosclerosis. B. Bronchospasm. C. Pulmonary embolism. D. Coronary artery disease. The correct answer is B. Bronchospasm refers to the narrowing of the airways in COPD patients, leading to increased airflow resistance and difficulty breathing. Which of the following triggers can worsen heart failure symptoms? A. Regular exercise. B. Salt-rich diet. C. Adequate hydration. D. Stress management techniques. The correct answer is B. A salt-rich diet can worsen heart failure symptoms by causing fluid retention and increasing the workload on the heart. Which of the following conditions is characterized by the inability of the heart to pump enough blood to meet the body's needs? A. Hypertension. B. Heart failure. C. Ischemic heart disease. D. Asthma. The correct answer is B. Heart failure is a condition where the heart can't pump enough blood to meet the body's needs. This leads to symptoms like shortness of breath and fatigue. What is the term used to describe the abnormal narrowing of the coronary arteries due to the buildup of plaque? A. Atherosclerosis. B. Myocardial infarction. C. Angina pectoris. D. COPD. The correct answer is A. Atherosclerosis is the condition characterized by the narrowing of the coronary arteries due to the accumulation of plaque made up of cholesterol and other substances. Which of the following is a common feature of asthma exacerbations? A. Increased lung function. B. Improved breathing. C. Wheezing. D. Coughing. The correct answer is C. Wheezing is a common symptom of asthma exacerbations, along with coughing and shortness of breath. What is the main cause of a heart attack? A. Chronic high blood pressure. B. Atherosclerosis, blocking the coronary arteries. C. A sudden jump in heart rate. D. Smoking. The correct answer is B. Myocardial infarction is usually caused by atherosclerosis, leading to the obstruction of coronary arteries, thereby reducing blood flow to the heart muscle. Which of the following medications is commonly used to treat angina by widening the heart's arteries and improving blood flow? A. Statins. B. Beta blockers. C. Nitroglycerin. D. Anticoagulants. The correct answer is C. Nitroglycerin is a commonly used medication for angina. It dilates the coronary arteries, improving blood flow to the heart and relieving chest pain. What is the term for reversible airflow blockage in COPD patients, worsened by things like cigarette smoke? A. Emphysema. B. Chronic bronchitis. C. Bronchoconstriction. D. Airway remodeling. The correct answer is C. Bronchoconstriction is the term used to describe the reversible blocking of airflow in COPD patients. This can be worsened by triggers like cigarette smoke, leading to symptoms like shortness of breath and coughing. Which of the following is a primary characteristic of hypertension? A. Low blood pressure. B. Narrowing of coronary arteries. C. Consistently high blood pressure. D. Widening of blood vessels. The correct answer is C. Hypertension is characterized by consistently high blood pressure measurements, typically exceeding 140/90 millimeters of mercury. What is a common symptom of severe heart failure exacerbation? A. Improved exercise tolerance. B. Decreased fatigue. C. Peripheral edema. D. Increased appetite. The correct answer is C. Peripheral edema, or swelling in the legs, ankles, or abdomen, is a common symptom of severe heart failure exacerbation, indicating fluid retention. Which of the following is a classic asthma symptom triggered by allergens or exercise, causing reversible airway obstruction and inflammation? A. Chronic cough. B. Cyanosis. C. Wheezing. D. Clubbing of nails. The correct answer is C. Wheezing is a classic symptom of asthma. It's triggered by allergens or exercise. This indicates airway obstruction and inflammation. It can be reversed with appropriate treatment. What is the most common risk factor for developing hypertension? A. Obesity. B. Genetics. C. Young age. D. Regular exercise. The correct answer is A. Obesity is the most common risk factor for developing hypertension, as excess body weight can lead to increased blood pressure. Which of the following medications is commonly used to treat heart failure, improve cardiac function, and reduce symptoms? A. Diuretics. B. Antibiotics. C. Antidepressants. D. Beta blockers. The correct answer is D. Beta blockers are commonly used in the treatment of heart failure to improve cardiac function by blocking the effects of stress hormones on the heart. What is the primary cause of ischemic heart disease? A. High cholesterol levels. B. Stress. C. Genetics. D. Reduced blood flow to the heart muscle. The correct answer is D. Ischemic heart disease is primarily caused by reduced blood flow to the heart muscle, usually due to a buildup of plaque in the coronary arteries. In chronic obstructive pulmonary disease, or COPD, which part of the respiratory system is mainly affected? A. Alveoli. B. Bronchioles. C. Trachea. D. Pharynx. The correct answer is B. In COPD, the bronchioles are primarily affected, leading to airway obstruction and difficulty breathing. Which of the following is a primary characteristic of hypertension? A. Low blood pressure. B. Consistently elevated blood pressure. C. Normal heart rate. D. Decreased vascular resistance. The correct answer is B. One of the primary characteristics of hypertension is consistently elevated blood pressure, typically exceeding 140/90 millimeters of mercury. What is a common symptom of severe heart failure exacerbation? A. Decreased fatigue. B. Increased exercise tolerance. C. Confusion. D. Improved oxygen saturation. The correct answer is C. Confusion can be a common symptom of severe heart failure exacerbation, often due to reduced blood flow to the brain. Which of the following is a classic asthma symptom triggered by allergens or exercise? It's characterized by reversible airway obstruction and inflammation. A. Chronic cough. B. Wheezing. C. Chest pain. D. High fever. The correct answer is B. Wheezing is a classic symptom of asthma. It's triggered by allergens or exercise. This reflects reversible airway obstruction and inflammation. Which of the following medications is commonly used to manage acute asthma attacks by opening the airways and reducing inflammation? A. Propranolol. B. Albuterol. C. Atorvastatin. D. Metformin. The correct answer is B. Albuterol is a common rescue medication for acute asthma attacks. It works by dilating the airways and reducing inflammation. What is the term for the progressive narrowing and hardening of arteries due to plaque buildup? A. Emphysema. B. Bronchitis. C. Thrombosis. D. Atherosclerosis. The correct answer is D. Atherosclerosis is the term used to describe the progressive narrowing and hardening of arteries due to the buildup of plaques containing cholesterol and other substances. In heart failure, which of the following occurs when the heart muscle is weakened and unable to pump blood effectively? A. Vasodilation. B. Cardiomegaly. C. Hypertrophy. D. Reduced cardiac output. The correct answer is D. Reduced cardiac output occurs in heart failure when the heart muscle is weakened and unable to pump blood effectively. Which of the following is a characteristic symptom of angina, often described as chest discomfort or pain that may radiate to the arms, neck, jaw, or back? A. Shortness of breath. B. Wheezing. C. Dizziness. D. Chest pain. The correct answer is D. Chest pain is a characteristic symptom of angina. It's often described as chest discomfort or pain. This pain may radiate to the arms, neck, jaw, or back. Which type of asthma is characterized by chronic airway inflammation, increased mucus production, and reversible airflow obstruction? A. Exercise-induced asthma. B. Allergic asthma. C. Chronic bronchitis. D. Cystic fibrosis. The correct answer is B. Allergic asthma is characterized by chronic inflammation of the airways, increased mucus production, and reversible airflow obstruction. Which of the following is a common risk factor for developing atherosclerosis? A. Regular exercise. B. High LDL cholesterol levels. C. Low blood pressure. D. Non-smoking status. The correct answer is B. High LDL cholesterol levels are a common risk factor for developing atherosclerosis, as it contributes to the buildup of plaques in the arteries. Which of the following is a feature of chronic obstructive airways disease, or COPD, characterized by destruction of the alveoli and loss of lung elasticity? A. Bronchospasm. B. Emphysema. C. Coughing. D. Mucus production. The correct answer is B. Emphysema is a feature of COPD, characterized by destruction of the alveoli and loss of lung elasticity. What is a common long-term complication of uncontrolled asthma, characterized by persistent airflow limitation and difficulty breathing? A. Pulmonary embolism. B. Respiratory alkalosis. C. Chronic obstructive pulmonary disease, or COPD. D. Sepsis. The correct answer is C. Chronic obstructive pulmonary disease, or COPD, is a common, long-term complication of uncontrolled asthma. It's characterized by persistent airflow limitation and difficulty breathing. Which of the following medications is commonly used to treat heart failure, reducing symptoms and improving heart function? A. Aspirin. B. Digoxin. C. Lisinopril. D. Metoprolol. The correct answer is C. Lisinopril is commonly used in the treatment of heart failure to reduce symptoms and improve cardiac function through mechanisms like vasodilation and diuresis. What is the term for reduced oxygen to the heart muscle, causing ischemia and possibly a heart attack? A. Heart failure. B. Angina pectoris. C. Atherosclerosis. D. Myocardial ischemia. The correct answer is D. Myocardial ischemia is a decrease in oxygen supplied to the heart muscle, resulting in ischemia and potentially a myocardial infarction.